welcome back to another episode of the Taboo Doctor. On today's episode, we're going to be talking about sexual health, especially when it comes to millennial men. And today we are joined by Dr. Douglas Pepple, who is an NHS GP registrar. He is also a YouTuber, and he encourages immigrant doctors on how to succeed within the NHS health system. Welcome, Dr. Pepple.
Thank you very much. It's good to be here. I hope we'll have a very lovely and robust conversation.
I hope so too. Tell us a lot about yourself.
Yeah, really nothing much to say. I'm Nigerian. I work in the NHS. I've been in the country for about 6 years now. So I'm a medical doctor. Presently, I'm a GP registrar. I've got special interest in sexual reproductive health and adolescent gynecology. Because I've got a postgraduate degree from the UK in reproductive medicine, IVF, and stuff like that. So I'm quite passionate about talking about sexual health for young people, and also I'm involved in kind of offering advisory services to international medical graduates who are migrating to practice in the UK.
That is awesome. And how did you get involved in doing that? Because obviously your videos are a huge hit on YouTube, and you do the mentoring sessions, you've got the Facebook groups, you've got the PLAB training. There's so much that you do for immigrant doctors. So how did you get into doing that, and how did it become such a huge success, which it is now?
I don't know if it's a huge success, if I'm a huge successful one, but so what happened is that, sometimes you come to a place and you kind of make mistakes, and for sake of goodwill, you don't want people who are coming after you to go through the same hurdle. So you just want to make things a bit easier for them. So when I came in, I realized that it was quite difficult to get the information I needed to get my feet running in the NHS. So I made a couple of mistakes and all that. And my friends keep messaging me from abroad asking how do they get to do the same thing I've done. So I just feel like instead of answering them one after the other, I can just make like a general video so anyone who is in similar situation can find it quite useful and helpful. So that was how I started. And surprisingly, it got accepted by a lot of people, and I'm quite happy for that.
Yeah, it's amazing. And I think, you've become such a resource for so many people. And so people normally signpost people to your YouTube channels, watch those videos. And I think it's so amazing when we turn things that have hurt us into victory for somebody else. Exactly. It's really great. It's like the religious people say that you turn your own mess into a message. So that's awesome. So today we're talking about obviously a topic that is passionate, part of your passion, and we're talking about sexual health in millennial men. When we talk about millennial men, and maybe also in terms of Black men as well, what do you want young millennial men to know about their sexual health?
It's quite interesting, to know, especially because of your handle and what you do, Taboo Doctor. So you're just trying to demystify a whole lot of things. And I think it's quite timely, especially for Black young men. I would say cultural practices and all this kind of stuff have kind of shrouded this topic in sort of secrecy or whatever. People are not comfortable talking about it. Meanwhile, it affects the very essence of our being. So for young people, for millennials, especially Black people, sexual health is quite pivotal in so many things, because if we get it right, then we'll probably get our well-being up and running. As it relates to how we take care of ourselves and how we expect people or significant other people who are in relationship with to also respond to issues concerning sexual satisfaction, sexual knowledge, hygiene, satisfaction, meeting expectations, and having a conversation around it,
Yeah, that is so important. And you were talking about Taboo Doctor and things, and what I found over the period is that women seem to be more open about talking about these kind of things, or reaching out to ask questions or send questions in. When I say, I'm having so and so on the podcast to talk about something, do you want to send questions in? And we had a sex coach a few weeks ago, and a lot of women sent questions in but no men sent questions in. And for today as well, men haven't sent questions in. As a man, as a
Yeah,
black man, and as a black
yeah,
doctor, can you talk
yeah.
to us a bit about that before we get into the science and the health, about that sort of social aspect and the cultural aspect that prevents men from seeking out help and also talking
Mm.
about things that affect them?
I think naturally men have this superiority ego, feel like we should be all knowing, and asking someone else for help, especially in this aspect, seems like he's being subservient, and that's what most men don't like. Also, your channel seem to, I think you're on the channel, so going to a female counselor or going to a lady to talk about things that happen down there is a bit, some people may cringe at the thought. But I think with education, with breaking cultural barriers, people are beginning to be a bit more assertive. People are beginning to be a bit more open, trying to take things, their health, especially in their hands. And I think it's quite important for people for men, to seek for help. It doesn't matter who you're looking or who you're going to for this help. If you feel it's important, the upbringing, the cultural norms, the traditional barriers, and everything which sort of seem to be the default setting of men, these are things that we should use information to break. You know, realize that you've got a problem. That's the starting point. If you've got a problem, how do you go about it? You need to get help. Where do you get this help from? It doesn't matter where. In as much as it's quality help, eventually it's going to help you to, because sexual health, sexual education affects every aspect of your life, especially your mental health as well. When there is stress in a relationship, when there are issues, unresolved, unspoken issues, somehow, sometimes it points towards unfulfilled sexual expectations. And if that's not addressed, it means you're not touching the root of the matter. And that's why this enlightenment, this conversation, and all this effort towards trying to demystify all these things are quite important. That's what I think.
That is great. That is so important. So why
Yeah.
does safe sex matter?
Safe sex. Safe sex actually matters because when we're talking about safe sex, we're talking about practices and sexual practices that will lead to preventing or reducing transmission of sexually transmitted infections, STIs, STDs, and also to prevent unwanted pregnancies. Okay, unwanted pregnancies has its implications on the health of the person, the society, and even the economy of a nation. Okay, that's for unwanted. Then, if you talk about STIs and STDs, apart from the immediate acute problems in terms of health implications, if it's not treated properly and on time, the complications may lead to compromising your fertility and also even your life at the end of the day. So if we don't want these adverse end outcomes, then it's important that we start talking about safe sex. And what's that safe sex? We're talking about how do we engage in sexual practices that are pleasurable, that are convenient, and that are fulfilling to all the parties involved. And that is what safe sex is all about.
And so, on a practical level, what does that look like for a young man? What does safe sex look like for a young man?
So for a young man, on a practical level, it is you are in a relationship with a lady, or you're in a relationship with someone. It doesn't matter the gender. Yeah. So if you're in a relationship with someone, then you have to decide, how do we want to consummate our relationship? What patterns, what practices? And when I say practices, I mean sexual relationship will be, in terms of intercourse, will be either oral, will be anal, will be vaginal. So what routes of sexual intercourse are we going, and how do we want to protect ourselves? Bear in mind where we're coming from in terms of past sexual histories. So the person you're with now probably has a past sexual experience with someone else, and you don't know what has happened or the outcome of that experience, and now you are with this person. You probably would have been with someone else. So you see, it's just like a chain reaction. So we young people need to define, now that you've been with people in the past, you don't know what's happened. How do we not have any complication or any problem in our present relationship? So that means we need to sort ourselves out. We need to probably get tested, probably make sure that we're starting on a background of, of everything being on the right, in the right perspective. So it's about young people who are involved in sexual relationship, deciding how they, what kind of sexual practice they want to go ahead with, and how they want to sort out any issue that must have that lingered, so they don't bring it into their new relationship, and to remain safe, and continue having pleasurable sexual experiences going forward.
Yeah. And so a lot of times when we talk about safe sex, especially for men, we talk about getting tested, first of all, and then we then talk about using condoms and barrier methods in sexual encounters, whether it is with a male partner, a female partner, or regardless of gender. So in terms of initially going to the getting tested part, because that goes back to what we were talking about in terms of people seeking out help and seeking out knowledge and information. When would you say that a young man should go to get tested, and how frequently should he get tested depending on his lifestyle and sexual preferences?
Yes, so that's quite a good one, but let's kind of debunk a myth. People think you only go get tested if you've got symptoms or if you've got STIs. And so the symptoms they will probably look out for will be if you've got burning sensation when you want to wee, or when you have sex, you have like pain on penetration, or you have some injuries, sores, or something around your genitals and all those things. And they feel, oh, if you've got this abnormal discharge, then you need to go get tested. That's fine. But that is not really the only reason why people should get tested. It depends on what country you live in, though. If it's in the UK, for instance, I know that young people who are below the age of 25, get annually tested. So you get tested for sexually transmitted infections, and most likely the ones they're looking for will be things like chlamydia, which is the highest, gonorrhea, and a whole lot of them. One of the reasons is because these infections are mostly asymptomatic. So when we say asymptomatic, for people who are listening, asymptomatic means you might have the infection, but you're not manifesting any symptom. So you just probably go ahead spreading and just passing this to everyone you come in contact with. So just to make sure we nip that in the bud, then we say, look, everyone go get tested once every year if you are under 25. And you might also get tested even more than once a year. Depends on risk factors you have. If you've had unprotected sexual intercourse with someone else who's not your normal partner, you know what? Whenever you are in doubt or you just feel something is wrong, and you start contemplating, or should I not? That means you need to get tested. So that's just it. Apart from all the normal things they will say, or if you've had sexually transmitted infection, or if you had the symptoms, after 2 weeks, we need to test you. If you have a risky behavior, if you've gone on holidays and you've had sexual contact with someone, you need to get tested. Like the one I mentioned earlier, for young people having being tested every year. People who are going for, let's say, for instance, termination of pregnancy. You also need to get tested before you have the procedure done. The reason for doing that is just so we are clear that you haven't got any infection that will probably complicate the whole procedure. Because some people can have post-abortion sepsis. That's like having an infection after or as a result of termination of pregnancy. So all these categories of people need to be tested. But in a nutshell, if this whole information is too much for you, what I would say is, whenever you are in doubt or you start thinking, oh, I'm not sure of what happened when I had sex with this person, did the condom or something burst, or was there any spillage of semen or sperm or something? Whenever you are in doubt, you just need to get tested. And the good thing is, I think testing is free.
Mm.
Yeah, it's free in the UK. I don't know how it is in other parts of the world. Yeah.
Yeah, that is really important. And I really like how you talked about the importance of getting tested even when you don't have symptoms, getting
Yeah.
tested when, you had different sexual partners or you've gotten into a new relationship. What about people who are in long-term relationships? What do you advise in terms of testing there?
So that's a tricky one. People who are in long-term relationship, because most time people start out, okay, meeting someone new, and we just go ahead, probably using a barrier method of contraception like condom or something, and it gets to the point, and they just say, "Oh, you know what? Look, we've gone past this stage. Can we not just start having this without?" So, meaning they're having penetrative sex without any form of protection.
Yeah.
And the assumption is that we are faithful to each other, isn't it? Yeah. And you just keep going. But if you start having symptoms at that point, I mean, you are in an established relationship now, and probably this person has rash or itch or burning sensation when passing urine, some sores or something like that, and or even ulceration. Uh, and you start, it's not like you're suspecting your partner, but for the sake of having a good health outcome,
Yes.
then at that point you can decide to say, you know what, let's get tested. And that's the thing now. When people get tested and it's positive, for instance, there's something we call contact tracing.
Yes.
So that means you need to look back 3 6 months backwards. Who have you been in contact with sexually? And when we say that's why we're a bit should I say, a bit careful with the word contact, because when we say sexual contact, it doesn't necessarily mean someone you've had proper penetrative sexual intercourse with.
Yeah.
So anyone you've been with in terms of having a sexual contact with them, we trace back to see if they've got symptoms. If they haven't got symptoms, then they need to get tested, and if they are positive, then they get treated. And like I said earlier, the essence of the treatment or the early testing, detection, and treatment is just to avoid the complications, which might be detrimental to your health at the end of the day. Yeah.
So that is really important. And, we've talked about barrier methods, and I think it just brings me really nicely into talking about I don't know if it's a phobia of condoms or a dislike of condoms among a lot of young men. So, we were talking to a lady on the episode, and she was talking about her own sexual practices, and she lives in Lagos, and she's very vocal about her sexual practices. But she was talking about how difficult it is to encourage men to use condoms, and a lot of women often talk about these issues where a lot of men refuse to use condoms and don't want to use condoms. So what do you say to young men who feel that, condoms diminish the sexual pleasure that they have during sex, and so as a result of that refuse use of condoms during sexual intercourse?
Perfect. Okay, so before I come to that, so just touching on condom, you talked about refusal of using condoms, myth about using condom in terms of reducing sexual satisfaction and pleasure, and also the other thing we need to touch on is the availability of the condom itself. Growing up, right, in Nigeria and Africa, people think that if you've gone past the teenage age, the age of consent for you to start engaging in sexual activity, it's not a misnomer for you to have condom in your possession. It doesn't mean you're being reckless, or it doesn't mean you're just hoping to get onto the next person and have some sexual escapade or something. But it's possible that these things can happen. It's part of the growing up phase, right? So you need to protect yourself. So that means you need to have that accessibility to the barrier method, which is the condom, most likely. And so the practices, the cultural practices, that's where enlightenment comes into place, where people don't really have that, they are not open to seeking for places or help to get condom. First of all, it's a problem. And I think there's the restrictions sort of seem to have been played down by some agencies who try to put condom in public places, even for free. Even in the hospital, sometimes you go to the toilet and you see a vending machine that has got condom. So meaning you can, yeah, if you feel shy to go get this publicly, you can get it from there. So, and high institutions, places where young people are predominantly, they are employing this particular pattern to make sure that this gets easily accessible to every young person, which is one. Then coming to the aspect of refusing to use condom, and that the truth of the matter is that speaking from a male perspective, yeah, there's actually a difference between using condom and not using it. But I like to look at things from both sides of the coin. First of all, the advantages of using condom is that it prevents sexually transmitted infection and it prevents unwanted pregnancies. Of all the other methods of contraception, condom is the only one that will prevent STI. The other ones prevent pregnancy, but they don't prevent STI. So, and condom is the cheapest of all of them.
Yes.
So that's getting two for the price of one.
Yeah.
And also the advantage, which a lot of people don't really think about, is that if you've got a sexual dysfunction, especially if you have a premature ejaculation and all that, condom is one of the methods that will help to reestablish a proper sexual pattern for you, because it delays ejaculation. So if a young person is having that problem, some people can have ejaculatory problems based on functional problems or based on organic problems. So if you have it based on functional problem, then condom is good for you because it will help to delay it and it will give you that sexual satisfaction and even your partner as well. Because at the end of the day, the essence of having sexual pleasure or sexual intercourse is, apart from procreation and every other reason, it is also for pleasure. That's it. But in terms of sensitivity, and when I say sensitivity, having the feel, condom will diminish the sexual sensitivity. But remember how I said it increases your it delays your ejaculation, so it increases pleasure. So pleasure in terms of duration and satisfaction for you and your partner, and sensitivity in terms of having the skin to skin contact, which will probably lead to premature ejaculation if you've got that problem, and at the end of the day the needs of your partner is not met. These are the things that you need to put side by side and weigh the options and do the risk benefit ratio, whichever one is good for you. But at the end of the day, in the long run, condom, I think, is better than having unprotected sexual intercourse, especially when your relationship with your partner has not really been solidified in terms of trust and faithfulness, if you get what I mean.
Yeah, definitely. And so what kind of advice would you then give to a young person who was having a casual sexual relationship with a man who was resistant to use of condoms? How would you, one, encourage them to maybe get them on board to use condoms, and what kind of advice would you give them if you were counseling them in a session?
Yeah, so because you use the word casual, I suppose that is not that is a random kind of sexual relationship. So your health is more important. You need to the whoever it is you have a relationship with, who's demanding having a non-condom or non-barrier method kind of sexual intercourse, you need to explain to this person. But you can start by, if it goes on to become more of a regular relationship, or you having regular intercourse, then you need to have a conversation with this person. You need to know about the person's sexual history. So he needs to come clean, tell you what's happened, and probably both of you just need to get tested. That's the thing. So both of you get tested, and if you come clean and clear, then you go ahead and start having sex without the use of a condom or something. But if there's any doubt, like I said from the beginning, if there's any doubt, then you need to protect yourself, because that is the most important. The complications that will arise from STIs and the complications that it will lead in terms of affecting you, compromising your fertility. These are things that you don't want to play with lightly.
Yeah, that is really important. And I think that also comes into play where people are more educated. So the more people
Mm-hmm.
are aware of STIs, safe sex, safe sexual
Mm-hmm.
practices, the more
Yeah.
they make better choices and the more
Yeah.
they make better decisions as well. What would you say to the culture of not wanting to talk about sex too quickly to young people or young men, in the fear that it will make them engage in sex sooner than they probably would have? Do you think that that is a valid concern to delay sex education, or do you feel that we should actually do it sooner rather than later so that people can make better choices?
Yeah, so if we don't talk about it, one way or the other, young people still will get involved in sexual activity, and they might get involved in the wrong way
Yeah.
because they haven't been. Information empowers people, and I feel like any information that is not transformational is not helpful. So that means from the onset, this needs to be discussed. That's part of the cultural barriers that make this whole thing shrouded in secrecy. So young people need to have this education. They need to know what they will probably be coming in contact with. They need to know what is safe and what is unsafe sex. They need to know about contraception. If they have Gilead competence, uh, if they can make decision for themselves, then they need to know about this on time, empower them with this knowledge and information, create a comfortable atmosphere for this conversation to thrive from a non-judgmental perspective, and let them share the experience and let them tell you things. And that's why I think every institution should have not just an advocacy group, should have a young people's counseling unit where they talk about this even beyond the curriculum of their schools. It might not be taught in a proper way in the school setting. Sometimes they just teach about reproduction and reproductive health and all of that, but an atmosphere of openness where they feel you can explore their vulnerability and talk about these things. Let them know what they should be doing, what they are going to come up against. That empowerment, will really go a long way. And for young people to also be honest with their counselors, their doctors, and volunteering information and sharing. So I'll tell you a story. When I was in medical school, so that was fifth year. Fifth year is normally the year where we do obstetrics and gynecology. So I was in the consulting room with other medical students, with the professor, probably his late 60s, and a young girl of 17 came in after the whole clinic. She was about leaving, and she just said, "Can I ask you a question, Prof?" And he said, "All right, go ahead." And she said, "Is it safe for me to have anal sex with my partner?" And his glasses just dropped. I was like, he was so uncomfortable. So when she left, he said, "That girl has got an evil spirit." So you see, this is the thing. That's what we're talking about.
Yeah.
People, probably she's had stories or conversation with her friends and all of that. So she wanted to get the medical aspect of things. Should she have it? At that point, I think the best thing to have happened is to first of all ask her, why have you asked this question? Is there anything that's happened that's warranted you to ask this? Explore her concerns, and try to meet her expectations. Answer in a manner that is suitable for her at that time, and that's it. So if people get information from professionals, they tend to hold on strongly to it than whatever information they get from anybody else. So that's why professionals, whether medical or counselors, should be properly empowered to pass on this information to people who come to them, especially young people.
Gosh, that is, yeah, that sounds like quite. I can imagine how she must have felt leaving that
Yeah.
consultation when she's supposed to
Yeah.
have the professor who's at the pinnacle of his career and
Yeah.
giving her the information, that she needs. And that brings me back to sort of culture and the fact that you said she has an evil spirit. That is a very culturally pervasive sort of mentality, especially when it comes to sex and sexual practices. What would you say to parents about educating their children at home about sex, especially in the Black context where a lot of these things are very hush hush, and we don't say that children came from sex. They randomly landed from heaven into the household.
Yeah.
How do we talk about that to young children?
Yeah, that also is an important aspect of the whole conversation, because parents, I think, need to use languages that are specific to the age of whoever they are talking to. So you start early. You don't wait until when they know what is sex and what is not sex. You start early by, if you want to develop your personal lingo for genitalia and organs and all that, do that, but let them know not just the function, in terms of, because I know some people say, tell you this is PP and that's just it. No. So you need to tell them, depends on the age, that if a man brings his PP to you, tell him no, you can't touch it, or you don't have to see it, because this can happen. That is at that level. Then it gets to another level where you go ahead to explore more, explain more to them. So it's important for parents, caregivers, to use appropriate language for the age and sex of the person to explain these things, because now we've gone past just normal, even in terms of gender, we've gone past normal binary gender. And children, young people need this information so they don't get dazzled by what they see in the society. And that's the only way they can adjust properly, to things that happen around them.
Yeah, that's amazing. And so coming back to men and their sexual health, and also taking responsibility and agency of their own bodies, what advice would you give to men about their penile health and their scrotal health as well, just in terms of hygiene, to both circumcised and uncircumcised men?
Yeah, the first thing I would say to men for to take care of their penile health is watch out for symptoms, or watch out for things that are abnormal. So if you start seeing blisters, start seeing bumps, start seeing rash or something on your penis or something, then it is not normal. At the end of the day, it might be normal, but it's better you speak out first and seek for help. Okay, and it boils down to what we've talked about from the beginning in terms of condom for sexual intercourse. The importance of condom cannot be overemphasized. Apart from preventing STIs, pregnancy, and all that, it's also important that people even use it correctly.
Yes.
Yeah, using it correctly is quite an important bit of the whole thing. Some people use, they feel, let's say the lady is, they feel the lady is not well lubricated, or she's not, wet down there, and they want to help by moisturizing the condom and all that. So if you use some sort of lubricants on the condom, because they are made of chemicals, they can cause some break in the condom. Some of them are quite invisible, and that break can be a route for exchange of body fluid, semen, vaginal fluid, and when that happens, there can also be transmission of STIs from that. That can also lead to sores. When you have sores, irritation, or abrasion on the vaginal wall or the penile wall, that can also be a means of transmission of STIs. So it's important for people to know that even though you say, "Oh, okay, I use condom," you have to use it correctly. If you think you want to lubricate your condom at any point at all, it's better you use maybe a water-based lubricant. Not something that's got some chemicals in it. All right, so that's one aspect of taking care of your penile health, and like I said, watching out for symptoms and taking that seriously as well, and yeah, just being proactive generally. If you've got an infection, it needs to be treated on time. Uh, Not all infections from of the penis are STIs.
Yeah.
So that's also something. You might be having discharge from your private part, or it might be peeing more times than normal. It might be something else, maybe diabetes or something related to your scrotum. And for older men, it might be something related to your prostate that needs to be sorted. So that's why you need to be proactive with your health and be outspoken, seek for help, especially from professionals, from doctors, from your GP when needed. And the most important thing is to be responsible in the sense that you're looking out for the health of your partner as well. Not being selfish, because at the end of the day, if you're not protecting yourself, or if your partner isn't protecting herself or your partner's self, then whatever you think you're trying to achieve at the end of the day will just amount to nothing, because both parties are not working as a unit.
Yeah, that's so important. Looking out for each other in relationships, in whichever sphere they come. And the last question, which we hadn't touched on in terms of our topic notes, but I think it's quite important when talking about sex, is last year there was a huge move in terms of Me Too when talking about sexual encounters, and a lot of men were finding that consent lines had become very blurred, and conversations about relationships, or even soliciting someone to go for a date, or when is it appropriate to kiss somebody, when is it not appropriate to kiss them, and how is this touch going to be interpreted, things like that. What would you say to men who have gotten themselves into this situation where they feel so confused about what the rules are, in terms of the rules of engagement are, in terms of developing a sexual relationship with somebody brand new?
I mean, I'm so happy you asked this question, because this is quite of a slippery slope.
Yeah.
So I had conversations during the first lockdown, with a lot of people. I was doing a show with some people, and we just had conversations around this, especially as it got to do with some form of I think some celebrities and all that having issues with rape and consent, and how blurry the line is. What I would say is, like they always say, no means no. But for men, especially black men, we've been told that no might mean keep trying. And I don't think that's completely wrong. No can mean keep trying, but keep trying how? Is it keep trying in terms of communication, or keep trying in terms of pressure physically to have a carnal knowledge of someone? Then that is no. So if you talk to someone, if you like someone, talk to the person, and the person says no, that doesn't mean you have to stop. If that's what you want, you can go ahead to reestablish the conversation again. Conversation, not anything else. But if it gets to the point where both of you are in the same place and you feel that's an atmosphere for intimate intercourse, and the person says no, that no is no. So that's the consent, and the consent also can be withdrawn at any point in the process of the sexual encounter. So if there's an implied consent and there is an outright one. So implied, if you start the whole thing, you think you're going along well, and the person, sometimes you don't need to ask someone, can we have sex now? You don't necessarily need to ask that. Depends on what level of relationship you've got into. But even if in the process you feel you've got this mutual consent, or non-verbal mutual consent going on at the end, and at some point this person feels detached and said, no, you know what, let's stop, then you have to stop, because if you go ahead, it means there's no consent. And the elements of rape before used to be force, carnal knowledge, and lack of consent. And now, it, I mean, can lack of consent is top on the list. You know, because if you look at sex, especially penetrative sex or non-penetrative sex, non-penetrative will be where probably mutual masturbation and things like that, smooching, rubbing of bodies and everything. Even that also has an element of consent in it.
Yeah.
So in general, if there is no outright consent in any sexual encounter, then it might be interpreted as rape. So that's where people need to be careful, and not just men, because it can also be on the opposite, although men seem to be more on the offensive. So you need to establish that we are on the same page, and if at any point we feel like we are not speaking the same language, then they need to go back and reevaluate things and decide if you need to go forward or not. Because at the end of the day, mutual respect for each other has to come into play.
Yeah, definitely. Yeah. Thank you so much for that. I think that was really, really important that we touch on that, because we can't really talk about sex without talking about the importance of consent. So that was an amazing episode. And just as we are rounding up, what do you want men to remember about safe sex?
Okay, so basically, for safe sex, we've said that there are practices that will empower a man or will empower people to engage in sexual relationship intercourse that will prevent or reduce the exposure to STIs, prevent unwanted pregnancies, to have pleasurable experience, and to prevent complications that will arise from STIs. So it's important that everyone takes charge of their sexual health. If you notice anything that is abnormal, anything that is out of the norm, if you ever think or you're in doubt of anything, then that means you need to get tested. Testing is an important and pivotal part of sexual of STIs, especially in places where the testing is free and affordable. You should take that option, get tested, and before you dive into having regular unprotected sexual intercourse with someone of the opposite sex or someone who's your partner, you need to know their past sexual history. And even though they might not have any symptom at the moment, past sexual infections can be a bit hidden, so to say, for a long time, and can just come up at any time. So that's why it's important to go back in time, know about the history. Everyone gets tested. If you need to get treated, you get treated, and so you can be well empowered to have a wonderful sexual encounter, so to say. And it's important that people, young men especially, also break the barrier of not having conversation around sexual experience, sexual pleasure, and sexual dysfunction. If you've got any of these problems, you need to meet a counselor, meet a doctor, speak to the person, and seek help appropriately. Yeah.
That is amazing. Thank you so much, Dr. Peppel. Where can our listeners and viewers find you online?
So online, I'm very active on Instagram. My Instagram handle is Dr. Peppel. That's DRPEPPLE. And on Twitter is Dr. Peppel Daddy, I think. Yeah, those are the two ones I'm very, very active on. Yeah, so just get in contact, and if you've got any questions, especially if you're an IMG International Medical graduate, if you need any help, I offer free advisory services, and I'm happy to help you to overcome any pitfall so you don't make unnecessary mistakes and you can have a nice time in the NHS if that's your dream.
Fantastic. Thank you so much for joining us on today's episode.
And also, thank you for having me. I don't even understand how you got to pick me of everyone you should pick to be on this episode. It's quite, I really appreciate I really appreciate the partnership. Thank you very much.
Thank
And
you.
yeah,
It's been
it's
it was a really good conversation.
all right.
And yeah, I think it's very, very useful. And it's so important to talk about these things because yeah, yeah. Thank you so.